So we are on the reproductive system. We have the testosterone, which is secreted by the steroid hormone, and it is secreted by the interstitial cells of the testis, which are acting from the adrenal cortex, which is the zona reticularis. Then we have the actions, which is the role in the intrauterine life. It dissolves the Mullerian system, the male genitalia. At birth, the descent of the testes in the scrotum, and puberty, the hair from axilla, vocal cords, mineralization of bones, muscles, heights, etc. Then it have the sebum, acne, protein metabolism, as it is an anabolic hormone. It increases the protein synthesis, increases the weight, scalp hair, then it has the frontal baldness, like this. Then we have the action on the reproductive system, like semen formation begins and is ejaculated intermittently during the sleep, and it is called as night emission. Then we have the limbic, which is it stimulates the development of sex desires and attraction develops towards the opposite sex. Then we have the regulation. Regulation is hypothalamus is acting on the anterior pituitary through the GnRF, which has a positive effect. Anterior pituitary acts on the interstitial cells under the effect of LH. Interstitial cells acts on testosterone, and testosterone gives a negative feedback mechanism on hypothalamus. Then the applied part is the cryptorchidism, which is the therapeutic uses under undescended testis and chronically bedridden patients to prevent osteoporosis. Testosterone injections are used. Noted male bedridden patients, and it stimulates the limbic system, which in case of impotence, and then used for doping for players, you to power ginseng plant something, and then it develops the muscle powers. Then what is puberty? Puberty is the age at which gametogenic function and endocrine function of the gonads reach to at such level that reproduction is possible. Cause of puberty is awakening of hypothalamus, which starts secreting GnRF. Then we have the factors affecting the puberty. Hereditary factors, nutritional factors, vigorous athletic training delays puberty, high mental stress delays puberty, systemic illnesses like diabetes, tuberculosis, then climatic changes is like cold countries puberty is late, and in warm countries it is early, which is called as precocious. Precocious puberty occurs if there is testosterone secreting tumor in testes. This is the applied aspect of it. Then the functions of the testis. Testis has three parts, like spermatogenesis, the testosterone, and the Sertoli cells. Then the spermatogenesis occurs in the seminiferous tubules at the age of male puberty. Seminiferous tubules are lined by the spermatogonia. They divide under the effect of FSH, and first division mitotic takes place under the effect of FSH, then which is mitotic. Then second division takes place at the meiotic division, and where the two spermatids are formed, which is 22 plus X and 22 plus Y. Then there are three phases in spermatogenesis, like first meiotic division of spermatogonia, which forms 64 spermatocytes. Then we have the chromatid duplication, then 512 spermatids, and then spermatozoa. So phase of formation of primary spermatocyte, secondary spermatocytes by mitotic division, phase of formation of spermatids, and formation of spermatozoa. The three steps are proliferation, growth, maturation, and transformation. Then the testosterone secretion. It occurs in interstitial cells after the age of male puberty. Testosterone secreted directly enters the blood, circulates, and is responsible for pubertal changes in male. Hormone secretion occurs under the effect of ICHS and LH from the anterior pituitary. Sertoli cells, round secondary spermatid is converted elongated sperm. It is process of maturation of the sperm due to the tail sperm gains motility. Sertoli cells supply nutrition to the sperms in form of fructose, and necessary hormones, necessary enzymes are applied by Sertoli cells. Sertoli cells are endocrine cells. They secrete hormone inhibin. They also secrete the Mullerian regression factor (MRF) and secretes androgen binding protein. Androgen binding protein is also secreted by Sertoli cells. Then MRF inhibin and ABP is produced by Sertoli cells. Testosterone is produced by interstitial cells of testis. Their fute processes are tightly attached, and this helps to develop the blood testis barrier. Blood testis barrier is something which helps to prevent the entry of harmful products of sperm metabolism are like the harmful products of sperm metabolism are not permitted to enter the blood. Then hormonal control of spermatogenesis. Hypothalamus acts on the anterior pituitary under the effect of GnRF. Anterior pituitary acts on seminiferous tubules under the effect of FSH, and seminiferous tubules secrete inhibin which acts on directly anterior pituitary, then it is short loop, and if it acts on hypothalamus, it is a long loop. So this was for the test hormonal physiology of testes. And abnormalities are if testes remain in abdomen, then they are exposed to high temperature, so spermatogenesis suffer. People who are exposed to high temperature, like furnace workers, spermatogenesis suffers. In mumps, seminiferous tubules of testes are selectively inflamed, and if spermatogenesis suffers, in heavy metal poisoning, intoxication, arsenic, spermatogenesis also suffers. In cases of infertility, these results. Now, there is one more to add on to this reproductive system testosterone, which is the composition and function of semen. Semen consists of the mature secretions from the seminal vesicles. They contribute 60 to 70% of the secretion from the prostate, 20 to 30% secretion from the bulbourethral glands, and sperms contribute 2 to 5%. Quantity of the semen is 2 to 4 ml per ejaculation. Color is white due to the secretion of the prostate. Appearance is mucoid due to secretion of seminiferous tubules. pH is alkaline. Sperm count is 80 to 120 millions per cubic mm. More than 80% sperms are mobile. Seminal vesicles ingredients are fructose, etc. So supplies nutrition to the sperm. Prostaglandins given by the seminal vesicles provide motility to the sperms. Fibrinogen helps in the coagulation of semen. And the importance is in case of male fertility, semen examination for the sperm count is diagnostic test. If 80 to 120 million, then it is normal. If less than 40 million per cubic mm, it is oligospermia. If it is zero sperm count, then it is azoospermia. In all these cases, infertility occurs. Like causes of infertility may be block in the vas deferens by STDs, undescended testes, mumps, heavy metal poisoning, exposure to high temperature, etc. That's all for the male. Female video will come soon.